Okay, my name is Alden Delport. I'm a lecturer here at CQU and I teach the graduate certificate and diploma in tactical medicine. Because we want to try and equip students to deal with intentional mass violence incidents or black swan incidents, which is low frequency, high consequence events. Within that chain of survival, as we refer to it, first responders fit in various places. So for example, police officers will be the first on scene and they'll be the first to come into contact with patients. Paramedics will be next. And then finally, once the paramedics have evacuated the patients to the hospital, you'll have first receivers. So nurses, doctors, physicians, surgeons, that kind of thing. And everybody needs to be on the same page when dealing with these incidents. And this course will provide everybody with a common language to speak and a common set of skills that everybody understands when dealing with these types of incidents. Online study is valuable for students who are already working in demanding roles. Students don't necessarily have the time to devote to attending university or attending CQ Uni, and so we provide this course for them online. So most of the theoretical knowledge and most of the sort of underpinning knowledge that students are going to gain, they're going to gain in the online component of this course. But there is also a residential school which will then bring all the students in together, where they'll do scenarios and they'll incorporate their new knowledge into a set of specifically designed scenarios that place them in the types of environments that they would be expected to function in. The core of the course is divided into 3 specific units, the first unit being direct threat care. And that really gives the students the opportunity to learn about how their bodies are going to respond and how they need to respond within those environments and how they get to what techniques they can use to mitigate threat or to keep themselves safe. And then we go into some case studies as well, where we look at recent events in the world, recent sort of mass casualty events, intentional mass violence events, such as the New Zealand mosque shooting, indirect threat care. And with indirect threat care, this is really where the meat and potatoes of medical treatment in these kind of environments takes place. So it's very clinical. There's a lot of medicine being taught and a lot of new sort of techniques and procedures that students can incorporate into their day-to-day practice. And then the third part of the course is prolonged field care, where you may have evacuation deferred for a unknown time period. And physicians, paramedics, nurses will then need to treat patients within that prolonged sort of environment. And this course will also give them the skills to do that. So if you're interested in working in contracting or working in very austere, very remote locations, this course will also equip you for that. Students undertaking this course will be innovators in this field. So whereas in some parts of Australia, there is a warm zone capability, in other parts of Australia, there is not. And students participating in this course will have the knowledge and skills to inform new paradigms within their services and possibly take on management roles in those services. So tactical medicine is an emerging field throughout the world, and this is the only university in Australia and possibly in the entire world where you can get a tertiary qualification in tactical medicine.